Okay, Stefano, I think we can go ahead and start.
Okay, so good afternoon and welcome to the first webinar for the series about laboratory reports. My name is Stefano Damiani. I'm the chair of Hospitals on FHIR. Please, next slide, Simon. Hospital on FHIR is a community, is a network of practice that involves more than 120 hospitals. That is not only hospital, but also healthcare provider and IT companies that are the supporters of the hospital in the implementation and adoption of FHIR, because this community is all about FHIR, the implementation, the workarounds, the solution, costs, times that are required to have the interoperability issues solved through FHIR, and of course also looking at the implementation of the EHDS, that is the subject of today's webinar. I give the floor to Luke, that is the ambassador coordinator for Hospital on FHIR. Please, Luke.
Thank you. So hello everyone. I'm also a FHIR consultant, and we are a member of the XiA project, which is an Erasmus project where the goal is simple. EHDS is coming, it's going to be FHIR and other standards, and we need to build the skills to make the EHDS work. So in the context of this training project, we are doing some partnership with XiA Europe and Hospital on FHIR. Next slide, please, Simon. This initiative is in the context of the Pact for Skills, which is a European Commission program to create skills and upskilling in Europe for professionals. Next slide. So as Stefano said, this is a whole series of webinars where the goal is to teach people willing to learn more about EHDS and the format on several 30 minutes webinars about specific topics. The goal of this series is at the end, thanks to this Hospital on XiA program, you have a better view on how you could in a hospital actually implement the EHDS format on lab reports. So I will give the floor to Simon on this first webinar. Thank you.
Great, thank you very much, Luc. Thank you to the Hospitals on FHIR organizers and HL7. And thank you also to you, everyone who joined. It's really nice to see this many people. Today, I'm going to be presenting for the first of this series of webinars. And even though the series will be about implementing the lab domain, today is pretty much opening the door to the series. And so it's going to be a more general overview of the European Health Data Space and its domains, especially for primary use. So about myself, just a word, I'm Simon Lewerenz. I am based in Lisbon. I work in ISCTE University with Professor Enrique Martins, for those who know him. And even though I have a management background, now we work a lot on health and EU health and digital health. And we coordinate this project, the Expanding Innovative Alliance, or XiA project, that is a 4-year project aimed at building capacity in the health workforce in Europe for the European Health Data Space, meaning for digital health interoperability. So today's session has 4 learning objectives. You should be able to quickly define the European Health Data Space, what it is, the purpose, and so on, the scope. Identify the 6 priority data domains for primary use, then introduce key standards, timelines, and actors of the European Health Data Space, and finally grasp how each of these data domains contributes to cross-border care and data reuse. So for this, I will list a couple of examples throughout. So in a nutshell, the EHDS, or European Health Data Space, is an EU regulation that is brand new, and it creates a legal framework to allow safe and efficient exchange of health data across European member states. It puts the individual at the center, a little bit like the GDPR did. It aims to give individuals ownership of their health data, enable cross-border continuity of care, and foster reuse of health data for research, innovation, and policy. Therefore, here you see that there are two sides to the European Health Data Space. There is the primary use, which relates to primary and patient care, and there is a secondary use, which relates to the reuse of health data for research, policy, or other related purposes. On the bottom of this slide, you see a quick timeline of the legal history that led to the European Health Data Space regulation. So to the left, in 2011, is the first legal text about cross-border healthcare in Europe. So it's a directive on the application of patients' rights in cross-border healthcare. That was the first of its kind, let's say. We mentioned also there in 2016 the GDPR, because the European Health Data Space is a kind of linked regulation to GDPR. It also protects individual privacy, but specific to health data. In 2019, there was a first Commission recommendation on the European Electronic Health Record Exchange format, which is what we're going to also look at today. So here we had the first formal draft of what this format would look like. In 2022, there was the proposal for a regulation by the Commission for the European Health Data Space, adopted by the Parliament in 2024, and the regulation entered into force on 26th of March 2025. So it's been almost 1 year from then. Here you can see the implementation calendar for the European Health Data Space with regards to primary use. As I mentioned, in March 2025, it entered into force. The next 2 years after the entry into force are dedicated to the drafting of what is called implementing acts. So the Commission is working with stakeholders to draft these implementing acts, and these acts are a legal instrument to detail the exact specifications and practical arrangements on how to implement what the regulation basically mandates, but with technical details and so on. In 2029, there is the entry in application for the obligations in relation to the first group of data domains. These first group includes patient summaries, electronic prescriptions, and electronic dispensations. And the second group of data domains will enter in application in 2031. So these relate to medical imaging, laboratory results, and discharge reports. So let's go a little bit more in detail now into these 6 priority data domains. They relate to primary use and this format. The format is the same format that I mentioned in the previous slide. It's the European Electronic Health Records Exchange format, and it focuses on these 6 priority data categories that are already defined in the European Health Data Space regulation text. These categories do not come from nowhere. They are based on the existing work and services that exist for cross-border care in Europe. These services are called and work with MyHealth@EU infrastructure, and the priority data domains are related to the domains that were worked with by the eHealth network, which is the highest governance body for cross-border eHealth in Europe. And so here at the bottom of the slide, you have the list of the 6 priority data categories as written in the regulation. They are patient summaries, electronic prescriptions, electronic dispensations, medical imaging studies and related imaging reports, medical test results, including laboratory and other diagnostic results and related reports, and finally, discharge reports. So the first of them, the patient summaries, they are defined as a structured, essential overview of a patient's core health information for safe cross-border care. And the aim of patient summaries is to support continuity of care and emergency treatment across member states, meaning cross borders. It is also enable clinicians to quickly access essential health data, such as diagnosis, allergies, implants, or medications, and serve as a gateway for citizens to view and manage their own data. For example, a use case that could be with the patient summaries is a patient has an implantable cardiac device and is hospitalized abroad, so clinicians can access its European patient summary through the MyHealth@EU infrastructure that already exists, and they can view allergies, the type of device, UDI, and also the latest vital signs in real life which leads to safer care. Regarding the data side of patient summaries, main data elements, there are others, but these are the key, and they are outlined in the Annex 1 of the European Health Data Space Regulation text. We have demographic information, active problems and diagnosis, allergies, intolerances, vaccinations, which were very well developed, by the way, with the COVID-19 pandemic. We also have medical and surgical procedures, medical devices and implants, vital signs, current medications, and test results and reports at a summary level. There are more, but these are the key elements. The second data domain is electronic prescription, which is a digitally issued prescription enabling the supply of medicinal products, and its purpose is to facilitate cross-border dispensing of medicines, prevent errors and duplicate prescriptions, strengthen pharmacovigilance and medication safety, and empower citizens to access their prescriptions anywhere in the EU, also via the MyHealth@EU infrastructure. For example, a patient can receive an e-prescription for hypertension medication in France, then travel to Portugal, and there have the pharmacist access the same prescription using the MyHealth@EU service. The data elements of electronic prescriptions, also in Annex 1 of the EHDS, include patient identification data, prescriber identification, date of issue and validity period of the product, the medicinal product, INN, dosage form or quantity, directions for use, and refill information and substitution rules. The third of the data domain categories is the electronic dispensation, which is a digital record of the medicinal product actually supplied to the patient. So the aim is to confirm that the prescribed medicine was actually dispensed, first of all, then support continuity of therapy when patients move between countries, enabling pharmacovigilance and medication auditing. And finally, to allow patients and prescribers to view dispensed versus pending prescriptions through the MyHealth@EU infrastructure. For example, a patient with chronic heart disease obtains refills for an anticoagulant prescribed in Finland while they are in Italy. The e-dispensation event is logged automatically in both countries' systems, updating the patient's shared medication record. The data elements of the electronic dispensation include patient and pharmacist identification, dispensing date and location, product identifier, INN, trade name, dosage batch, if applicable, quantity supplied and remaining refills, substitution or adaptation details, pharmacist remarks, or clinical notes, for example. The fourth of the priority data domains is medical imaging studies and related imaging reports, which are digital diagnostic images and their associated clinical interpretation. The aim here is to guarantee cross-border access to diagnostic images and their interpretation, reduce unnecessary repeated imaging and radiation exposure, enable telemedicine, second opinions, and AI-driven diagnostic tools to provide a trusted source of structured data for secondary use, for example, research, AI training, policy making, and so on. For example, a trauma patient imaged in Poland can have their DICOM formatted study accessed live by a surgeon in Germany with full radiology report translation and metadata traceability to ensure continuous interpretation. The data elements of medical imaging and related reports are imaging study metadata, modality, body site, date, institution, diagnostic reports, either structured or narrative, the referring and reporting healthcare professionals, the device identifiers, be it a scanner, a software, protocol used, and the image series identifiers and storage references using DICOM URI or equivalent. The next and fifth priority data category is medical test results, including laboratory and other diagnostic results and related reports. The name is long, but I have highlighted the key terms. So here, medical test results and laboratory. They are digital diagnostic images and the associated clinical interpretations as well. So the purpose here is to enable clinicians across the EU to access laboratory data for informed decision-making, support continuity of care and reduce redundant testing to provide high-quality machine-readable results for secondary use. And for example, a diabetic patient's glycemia results from a French lab is shared with their Spanish specialist through the MyHealth@EU infrastructure. They use low encoded value or a standard value, ensuring consistent interpretation. The data elements for laboratory reports include test identification and results, such as value, unit, and reference range, specimen information, such as type, collection date, analyzer ID, lab identification and quality accreditation of the lab, ordering physician or organization, and other relevant comments or interpretation notes. And the sixth and last priority data domain is the discharge reports. They are a clinical summary documenting care provided and follow-up instructions at the end of a punctual healthcare episode. So the purpose here of the discharge reports is to facilitate continuity of care after discharge, to provide receiving clinicians and patients with an accurate and up-to-date record, and to support post-market surveillance and data reuse, for example, for the safety of an implant or analytics of outcomes. And for example, a patient may receive a knee prosthesis in Italy, and their discharge reports, which includes device UDI and follow-up plan, will be available in France via the MyHealth.eu infrastructure, which ensures traceability and supporting patient safety during their rehabilitation process. The data elements of the discharge reports include the admission and discharge dates, care facility identifiers, diagnosis and clinical problems addressed, performed procedures and interventions, implanted medical devices if relevant, UDI, manufacturer, model, serial lot number, medication at discharge and follow-up recommendations, and treating and referring physician identifiers. So we went through the 6 priority data categories of the European Health Data Space for primary use, and they are all supported by the format, which in long version reads the European Electronic Health Records Exchange format, in acronym the EHRXF, otherwise also called the format. And these are the technical specifications basically behind these services. And so the definition of the format that I will read out for you, it is a set of requirements and technical specifications, as well as endorsed support materials targeted at ensuring the interoperability of electronic health records system following the EHDS and other applicable law. It is designed to enable the exchange of personal electronic health data between 2 or more EHR systems, other digital health applications or medical devices, and supports interoperable capture and reuse in a meaningful way. So the format is constructed by 3 things mainly. First of all, harmonized data sets containing electronic health data and defining structures such as data fields and data groups for the representation of clinical content and other parts of the electronic health data. Second, coding systems and values to be used in datasets containing electronic health data. And finally, the technical interoperability specifications for the exchange of such data, including its content representation, standards, and profiles. So these ABC dimensions are exactly one-to-one to what is written in the regulation. To understand the format, so it defines the common technical and semantic framework to share this data across EU member states, and its purpose is to provide the common structure for exchanging this data. It also looks at guaranteeing semantic consistency so that the data exchange carries meaning with it wherever it goes. And it supports all 6 priority domains that I mentioned in my previous slides. So these domains they were patient summaries, prescription, dispensation, lab results, imaging, and discharge reports. The format defines common information models, so which fields exist in each domain. It defines common terminologies and coding systems. For example, they could be SNOMED, CT, LOINC, ICD-10, ATC, or UCUM. The format defines common technical format, for example, HL7 FHIR, and also common transport layers for cross-border exchange, such as, for example, the MyHealth.eu infrastructure. And the format is important ultimately because it aims to enable clinicians to read and interpret data regardless of national language or system. It ensures data quality and comparability for research prior to secondary use, but it also, the other way around, sets a common target format for data output by IT systems or, for example, artificial intelligence systems. Finally, for the industry, it reduces vendor lock-in and promotes EU-wide interoperability certification. Now let's see if you have any question. If the audience has any question, I think there may be questions in the chat. You're free to also unmute at any point. We can unmute you, I think, on your behalf. Over and back to Rhonda, I think, for this.
Yeah, I'm just monitoring the chat. I think we've been answering them as we go along. Does anybody in the audience have any questions they want to pose? We can unmute you.
Oh, there's been a lot of discussion.
Yeah, there's been a little bit of back and forth. And I think we're kind of between the chat and the Q&A. There's one here. Luke, I think you're chatting with Alexei about on the slides, presenting around domain. Yeah.
It seemed there was a mistake on the slide because the definition of medical test results was the same as medical imaging on the slide. So more like a typo on the slide.
Okay. That case must have been a typo, yes.
Okay. Simon, a new question for you. How does consent work from Colin?
So consent is important part of the European health data space, but it's more addressed by the secondary use part of the regulation. So there is, for example, a possibility mandated by the regulation to opt out of any secondary use of your personal health data. And the mechanisms are still to be exactly defined, but it is explicitly mandated by the regulation that any individual can opt out secondary use of their health data, meaning opt out research, policymaking purposes, or, for example, industry innovation using your health data, yes.
And for the rest of the usage, it's going to be at the national regulation level. Every country has their own law on which patient rights can be applied to data. For example, in France, I know that in Mon Espace Santé, we can specify which doctor can see what, and it will probably be locally defined.
Yes, so the exact mechanism are still to be defined, but there is a lot of work ongoing. For example, in these EU projects, there have been a lot of piloting and trying out of different technologies to enable this individual control of their own health data. For example, in the XiA project, the project looks at developing a single button with which a patient can give access, retrieve their own health data, for example, and so on. And also in a past project, ExpandEH, there's been work with distributed ledger technology to ensure the patients, the individuals, can see audit trail of who accessed their data and for what.
Two new questions, one from Patrick. How does this relate to FMD and ISO IDMP for the unique ID of medication? And then one from Alexei. Simon, do you want to take it?
So I know that, again, at EU projects levels, there's been work for the prescription and dispensation part of these domains with IDMP. So a project that I can refer to you is Gravitate Health. They have been looking at that, and actually the project also was looking at translation of electronic leaflets. So they were expanding the domains into a domain labeled e-prescription, e-dispensation, and electronic product information. And so to aggregate everything at once, the medication information, the dispensation information, prescription information in different, also in different languages. So Gravitate Health is the project to look at.
And one question from Alexei regarding lab testing results. Are genetic tests included in the case of personalized treatment based on pharmacogenetic profiles, for example?
So here we have to separate between primary and secondary use. in primary use, currently only these 6 domains that I presented are in scope for the next coming years. For secondary use, genetic data is listed in the regulation. The domains scoped in secondary use are slightly different than the primary use domains, but genetic data for secondary use is also foreseen for a later date. So similar to primary use that has different deadlines for two groups of priority domains. So I presented one group will be applicable for 2029 and the other will be applicable in 2031. For secondary use, genomics is also foreseen for a later date. It is not a priority domain.
Simon, can you go to the next slide for because we have a question from Patrick on how we can progress. So I think yes, joining Hospital on FHIR, of course, if you are a healthcare provider, is one of the right steps to learn more about FHIR and how it goes in the community. You can also follow the XiA projects and join the community of practice to give us feedback about what you're waiting as content and help us build the content for training. As for the genomic aspect, from my point of view, it's probably going to be linked to the lab with additional stuff because lots of different projects on that, but like Simon said, not in the first wave, I would say. New question for you, Simon. When will we know whether SNOMED and H7 FHIR will be selected for the format?
So it is not definite yet. It will be formally official if it will be whenever the implementing act for the EHRXF comes out, and that is foreseen by 2027. And I know the Commission is currently working on it, and there is also the joint action. So it's a kind of an EU project with the European member state ministries of health and national e-health agencies working together to align and harmonize and provide recommendations to the Commission on which standards and other frameworks they prefer to use, and they are in communication with the Commission. But we will know this by 2027, whenever the implementing act related to the format will come out.
And I guess that also responds Maximilian's question on where can I find the technical details on the format. So in the future, I guess we will have but can we safely say, Simon, that the implementation guide that HS7 Europe is working on can be taken as 95% sure as a base for the format?
It is an interesting, very interesting option for the format for sure. Yes, this I can confirm.
Okay. And what about the XiA project?
Well, this I mentioned before. The XiA project is a joint action with the ministries of health of the member states and the national e-health agencies that work together to provide recommendations to the Commission. However, the XiA is going to end this year. I believe it's either March or April, so pretty soon. And so you still can access the deliverables that are public and so on online and look at their work there. There is some technical work also, yes.
So Rhonda, do you want to take the end for the?
Yeah,
I think we're on time.
we're out of time now, and we went through quite a number of questions. If you have any additional questions, I think Simon put his email address there in the chat. So on behalf of the team here, I'd like to thank everybody for attending this first webinar in the series. The next one is coming up March 26th at the same time, and the topic will be medical terminology. So thank you everyone for attending, and have a good rest of your day.
Thank you very much for attending and to the team for organizing.
Thank you very much.
Thank you.
Bye-bye.